All right, good morning, everyone. I say everyone, all 6 of you. Thank you for coming. We appreciate it. So, as Mike said, what we're going to talk about mainly today is going to be just a new benefit option, which you should all have the books for, right? Everyone has a book. All right, good. New benefit option for 2020, which is being introduced, as well as we'll go over some of the Medicare supplement information for those plans that currently exist today to make sure everyone just kind of understands how that all works. I know we have one individual who's currently on a plan. Who's on Medicare otherwise right now? One? All right, so the rest of you coming up in a year, couple years, coming onto Medicare, is that what we're looking at? Yeah, all right, good. A little bit longer than that, all right. All right, perfect. Yeah, well, and that's exactly, we go through a host of information that talks about when you're coming up on 65, what you can expect, what you have to do, how do you manage this as you begin to turn 65 if you then retire, or even if you retire thereafter. So we'll go through a couple of different things. Feel free to ask questions as we go through just to make sure we get everything covered. So we'll go ahead and get started. So the first thing, as I just mentioned, we're going to talk about original Medicare. So that is when you turn 65, what do I do? What can I expect? When do I get information from Social Security? How do I get Part B? What is Part B? How does all of that work? Then we're going to talk about the programs that are offered through the Institute. We have 3 separate types of plans that are offered through the Institute. What to expect if you enroll. Of course, it doesn't seem like anyone's enrolling necessarily for 1/120, but should you decide to change, that's an option as well. How to enroll, and then any questions and answers at the end. So, well, during and then at the end as well. So as we go through, we've been working with the Institute over the course of the past few months to come up with just a new plan option, one that gives you a lower premium in general, because right now you have the Medicare supplement and the Part D plan, and it's a higher premium every year. It goes up a little bit. Drug prices, as we all know, continue to increase, so that drives premiums upwards. Versus the new plan, which is the booklet, like I said, Medicare Advantage, which is everything really into one. There's additional federal funding that comes in for these programs, so it helps keep the premiums lower. So there's a couple different reasons why they're being instituted. So we'll talk mainly about the PPO plan again, which is the booklet that you have there as we go through. But to start, we'll talk about just Medicare. So this might be a rerun for a couple of you, but for the rest of you, this will be new. So when do you become eligible for Medicare? The rule typically is when you turn 65, or if you're under 65 and you qualify based on disability. If you qualify based on disability, that begins as of your 25th month of being on federal disability. You, of course, have to be a U.S. citizen or a legal resident for there. So again, 65 or under if you are disabled and qualify for federal disability. Questions on that at all? It's pretty straightforward, so, right. So from there, so original Medicare is where we'll start, just in terms of how that works. Good morning. How that works. So again, when you're turning 65, you will get information from Social Security and from Medicare about 3 months prior to your 65th birthday that will tell you the steps you need to start taking. The first thing to know is that you are automatically enrolled or eligible, as they say, for Medicare Part A. Okay, so Medicare Part A specifically is your inpatient hospital coverage through Medicare, right? So you'll get information saying you qualify for Part A, here's your Medicare card, it'll have your Medicare number and your Part A start date on it. Part B, on the other hand, is not automatic. You actually have to enroll into that. So in the package of information you'll get from Social Security, it will tell you, here's what you do. Call Social Security, call Medicare, sign up for Part B, which is your outpatient services, and let them know what date you want that to start, right? So the thing is, if you are 65 and you continue working, like maybe you're not ready to retire just yet, you don't have to have B at that point because you're going to have your coverage through your employer. So you are able to delay your Part B if you're actively working still. If you're not working, you do want to pick up Part B because if you don't, you could get a penalty later if you're eligible and didn't sign up for it. So just an FYI there. There is a premium for Part B. This year it is $135.50 per month. You do have to pay that premium on top of any premiums for any of the Medicare plans through the Institute, so just keep that in mind. They haven't released the 2020 premium amount yet. I've seen estimates of it being around 140, 145, but Medicare hasn't officially released the rate yet for 2020. So that should be coming hopefully in the next few weeks. Questions on Part A or Part B? No, does that make sense? Yep. All right, good. So once you have Medicare Part A and Medicare Part B, assuming you have at that point retired from IAS, then you have two options in terms of your retirement coverage. You have a Medicare supplement plan, which you then have to pair with a Part D, and we'll talk about what that means. And then you also have the new plan for 2020, which is the booklet you have, which is Medicare Advantage. And we'll talk about what exactly that means as well. So supplement plans really exist to cover the copays that Medicare doesn't, right? So for example, Medicare in and of itself pays about 80% of the cost of your care, and you then have the 20% that you would normally cover on your own. Okay, the supplement exists to pay that 20%. There's a whole host of different plan options that you could enroll into. They have different benefits. For those of you, well, for the one that is enrolled today, Plan F is the richest plan in 2020, and we cover this later on. Plan F is going away, and it's being replaced with Plan G. That was a congressionally mandated change. Good morning. Good morning. How are you? So we'll talk about what that means exactly. And then Part D, just to fill in the blanks on what that is, Medicare and the supplement plans do not include drug coverage, right? Outpatients, if you go to CVS or Target or wherever you go to get your medication, it is not included in original Medicare. So you then have to add a drug coverage, right? And that's what Part D is. So Part D is your drug coverage, your supplement pays what Medicare doesn't, and your original Medicare is kind of your basic coverage there that pays the 80% of the cost. Does that make sense? Yep. Okay, good. Just want to make sure because that was a lot all at once. The second option that you'll have is the Medicare Advantage plan, which again is new come 1/1/20. And what that does is it combines everything all into one plan. So the way it would work if you were to stay on original Medicare and then add a supplement and a Part D is you would have your red, white, and blue card that you get from Medicare. You would go to your doctor, you would provide them with that red, white, and blue card. Then you would also let them know you have a supplement, which is a different card, right? That's your United Healthcare supplement card. Then if you go to your pharmacy, you would have then a separate Part D card. So you'd have 3 cards all together, and you would use that to pick up your prescriptions, right? Whereas with the Part C plan, it's everything all in one. So you don't have to show them your Medicare card or your supplement or your Part D. It's just one card. It includes your inpatient care, your outpatient care, and your drugs all in that same card, right? So it's just combined all together. Additionally, for the Medicare Advantage plans, like I mentioned earlier, the premiums are lower on those plans because United Healthcare becomes the primary payer. So on your supplements and your original Medicare, Medicare pays first, whatever is left gets sent to the supplement pays based upon the plan you've chosen, and then you're responsible for whatever's left if there's anything left, right? With the Part C, United pays directly. The bills come straight to us. Medicare actually provides a subsidy to the private insurers per month to say, okay, you're covering the care of these retirees, here's X number of dollars to make sure that, it's a subsidy towards the care. So everything would come straight to United, and it would pay based on the benefits that you have in the booklet there in front of you. Again, that does include prescription drug coverage. Additionally, it offers a whole host of clinical programs and ancillary benefits that are not included today in the supplement plan. So that's another reason why the Institute's looking to put something else into effect that really gives you more of a holistic approach to your health versus just the supplement. So questions there? No? Yes. So we're going to go through some of those. So perfect, good question. So what additional benefits? We're going to go through them as we dive in a little bit more to the Advantage plan. But just some additional programs are clinical programs. So let's say that you're diagnosed with a chronic condition. We have a number of clinical programs that would go into effect. So if you have Alzheimer's or cancer or diabetes, something like that, then we have nurses that will reach out to your doctors to coordinate care. We also have a program called HouseCalls where a nurse practitioner will come and do a home visit with you just to answer questions you may have, see if there's any additional services that you may require that we don't know about from the beginning. And then there's also Silver Sneakers, which is the gym membership. Has anyone heard of that? No? Yeah, we have one. So Silver Sneakers basically gives you a free gym membership to certain gyms. That's included in the plan as well. So those are not included in the SUP, just to give you kind of a small summary of some of those.
But AARP does.
I'm sorry, but AARP does, right? Depending on which plan you're in, there's differences within there. Right. So to go through, we just talked about having to pair a supplement plan with a Part D if you take the route for the supplement, because again, the supplements do not include drugs. So you do need to make sure you add both. There is a plan offered today for a Medicare supplement and a Part D through the Institute, so you can still stay within the retirement benefits if you choose this route. But then you also have, like I mentioned, the Part C plan, which is Medicare Advantage. For those of you who are currently on Medicare, you should be getting your 2020 Medicare and You book. Have you gotten that yet? It came? Good. So if you have that book and you want to look at what is a Medicare Advantage plan, it's actually referred to as Part C in the booklet, so you can reference that. So if you want to look at it, A plus B plus D equals C, if you want to look at it that way. All right, so to get into some of the actual plan benefits for the new PPO plan, and let me actually grab you a book so you have something to reference. Oh, you have, yeah. As we go through, here you go. Sure. All right, so as we mentioned, the main point of the Medicare Advantage plan is to provide all of your care in one plan, right? Versus having your Medicare card, then your supplement card, and then a separate card for your Part D. Everything's all in one. So you have all the benefits of Part A, Part B, you have the drug coverage, and then some of the additional benefits that we mentioned earlier. So everything is all in the one plan. It is a national PPO, okay? So what that means is if you live in Jersey, well, obviously you live in Jersey now, or close at least, and you decide to move to Florida, Arizona, North Carolina, wherever you may go, you can bring this plan with you and not have to worry about a change in premium, right? That's a little different than the supplements today. Every year your supplement plan changes in its rate, may go up by a few dollars depending on which plan you're on. And if you move states, each state has different rules for how the supplements are covered. So you might move from Jersey to North Carolina, and now you have to pay a whole new rate, and it changes based on where you live. Whereas with this, doesn't matter where you are in the United States, it's the same rate, same plan, same card. You don't have to worry about calling and enrolling. You just let someone know, hey, I moved, here's my new address, and you go on with your life. So there's no worry there. Yes?
Could you perhaps go back once?
One more?
The one you had before.
Which one?
Just the screen you had before, where it says may include something. Yeah, just the one before this one.
For here?
Include, I thought it said
Maybe bundled with the plan, is that?
maybe. Is it or is it not?
So it is. In this case, it is. But again, depending on the plan design that, different groups may choose.
Yeah, it said included in many Medicare Advantage.
Right, so it is included in this, yes. So what we made sure that we did was with the Institute, we wanted to mirror as closely as we could the active coverage and then maintain the Part D coverage that has been offered over the course of the last several years. So it is definitely included, and the extra services are definitely in this plan. So there's not so much of a may around this. That's just the way the slides are built. But good question. All right, so back to this. So it is a national plan. It doesn't matter where you live, anywhere in the country or its territories. One of the questions that we do receive is, well, what happens if I go outside of the country? Do I have coverage then? You do for emergency and urgent care on the Medicare Advantage plan. So that is covered also, just as an FYI there. You do not need referrals to see a specialist. And are you familiar with, so let's just talk about how a traditional PPO works. And this is the same for this time of year. If your mailbox hasn't already started to blow up, it will shortly. And you've probably seen on TV, join the AARP Medicare Advantage plans, or join the Cigna Medicare Advantage plans, or any host of those. You're going to continue to see those. So the way a traditional PPO plan works is that if you go in-network, you have one set of copays, right? Let's say if you go to your primary care doctor, it's $10. But if you go out of network to somewhere where they don't have a contract, then you might pay 30 or 40% of the cost versus the flat dollar amount if you go in network. This plan allows you to go in and out of network for the same copay, not coinsurance, but copay. So there is no difference. So you're really allowed to see any Medicare provider as long as they send us the bill. We had some questions last week. Well, are there any issues in New Jersey? We have multiple clients in Jersey that are already on this plan, and we haven't heard any issues on providers, anyone not wanting to take the plan, anything like that. So if you want to check your doctors, there's a website, we'll go over it, but it's UHC, Uncle Harry Charlie, retiree.com. And from there, you can do a lookup of providers. If you don't see your doctor on there, it may be because we don't have a contract with them, but you can still go there. And if you want to check, if you're looking at this plan, on the back of your book and throughout it, there's a phone number you can call, and they can look up any of those doctors that you may have questions about. So they can look up your drugs, doctors, facilities, all of that. So if you don't see it on the website, don't freak out. Just call and double check. Any questions on that?
Is this just starting now, or has it already started in some states?
This plan?
Yeah.
It starts January 1st.
For the whole country, I mean, whoever wants to enroll.
Well, for any IAS retiree that wants to enroll, yep. Yep, so you can, if you want to enroll in this plan, you can do so 3 months in advance, so you would be able to call and do so now for a January 1st, but it doesn't start until January 1st, so your coverage can't start before that.
What are the rules about enrollment? When does the enrollment cease for the moment?
So the enrollment period, did we define, Mike, a stop date for IAS for people that want to enroll, like an open enrollment period if they're currently eligible?
I think the open enrollment was through the end of October.
Through the end of October.
Okay.
So there you go.
This month, yeah.
Correct, yeah. So if you're currently eligible for Medicare and you're on, let's say, the supplement, you have until the end of the month to elect this plan. But if you're turning 65 thereafter, let's say you turn 65 in March of next year, then you would, of course, be able to enroll for March of next year. It's based on when you become eligible. Just so happens that right now we're in the open enrollment period for IAS, which allows people to make changes based upon any choice they may have. Does that answer your question?
Yes.
All right, good. Yes.
So since this is all really new to me, it's kind of getting to be a little.
Yes, it can be.
I
Yes.
can't really follow too much. But is what you're talking about now something that's replacing something that already existed, or this is an additional?
So this is in addition to. So as it stands today, IAS has for quite some time offered Medicare supplement plans through United, as well as a Part D plan, which is the drug portion through United. So as I mentioned a little earlier, we've been working with the Institute to come up with another plan option that has a lower premium, but still gives you full coverage in your benefits nationally, et cetera, and is everything all in one. So this is in addition to the existing plan offering. It's not replacing. Any other questions there?
Will it replace eventually? Are they going to go in parallel for the moment, but eventually?
For the moment, I believe until 2021. In 2021, those individuals who are retiring, new retirees at that point, will, and correct me if I'm wrong here, this will be the main option, the Medicare Advantage plan.
And people who don't change, but were on Medicare before,
Mm-hmm.
their plans will just.
They'll be grandfathered into the plans they have today, correct? Yeah, so if you're on Plan J, let's say, come 2021, you're not going to get taken off Plan J, you can stay on that. It's just that any new retirees will then, this will be kind of the default plan, if you will. And there's, yep.
For the post-2021 retirees, there'll still be a choice. There'll be the Advantage plan or the Plan G. The Institute, hasn't been decided 100%, but for new retirees, the Institute portion that they pay to retirees will be based off the premium for the Advantage plan. And for those who want to join Plan G, again, for new retirees, will likely have to pay the difference in premium between the Advantage plan and Plan G. So the two plans are going to be offered, but the support structure around what the Institute is going to pay for is likely to change. But that hasn't.
So the advantage gap gets wider.
Yeah, so to make sure everyone heard that, so basically, come 2021, the MedSup plans will not go away. They will continue to be offered, but the subsidy that the Institute pays towards those plans will be based off of the amount for the Medicare Advantage plan. So if you're on the Medicare Advantage plan, you would have basically no premium on this, depending upon, of course, your subsidy structure. Whereas on the Plan G and the Part D, your premium is just higher by nature, so you will have more of an out-of-pocket cost for the premiums for those come 2021. Is that a good summary? Okay, good. Any other questions? Perfect. So as I mentioned, again, your providers are national. The plan is national. You can see any Medicare provider as long as they're willing to bill the plan, and there is no difference in those copays. And the uhcretiree.com, of course, is the website you can go to if you want to look up some of those doctors. All right, so to talk about the actual Medicare Advantage benefits. So your annual deductible is $0 and your out-of-pocket maximum is $2,000, all right? So one thing to look at when you're comparing Medicare supplement plans to Medicare Advantage plans is depending upon the plan you're looking at. Let's say, for instance, you look at Plan N on the Medicare supplement. There's a whole alphabet soup of Medicare supplement plans, just so you know. They don't pay parts of the Medicare deductible. So the Medicare deductible for Part A, so if you go into the hospital, is right around, I believe, $1,300-ish, right around there for 2019. So you'd have to pay that out-of-pocket deductible depending on the Medicare plan you're on. If you go on Plan G, which is the one that will be supported by the Institute starting 2020, that you do have to pay your Part B deductible, which is your outpatient services. And this year, I believe that is $138 for 2019. They haven't released it yet for 2020. So that, again, would be something that you'd have to take into consideration when you're comparing the cost factors. No deductible on this plan versus if you're on G, you're looking at least $138 plus then the differential in the prices for the two different plans based on the subsidy from the Institute. So there's a few things to look at there. In terms of the out-of-pocket maximum, this is the most, if you're familiar with out-of-pocket maxes, that you'll pay over the course of the year for medical services. Right, so $2,000 is your cap for the year. Medicare supplement plans, as they stand today, depending on which plan you're on, do not have an out-of-pocket max. If you're on a plan that, let's say G, where it's mainly $0 copays, obviously you're not going to have a whole lot of out-of-pocket. But if you're not on that plan, you may have some out-of-pocket expenses, and there's no cap on those today. One thing to note about this is this does not include drugs. This is only for your medical services, just to make sure we're clear on that. So the out-of-pocket max does not include co-payments for your medications.
So if you
Yes.
have an expensive operation, you might still have to pay up to 2,000, but not more.
Well, so depending on what we're looking at, so that might actually help us as we get into the next slide. So if you're looking at an expensive operation, in this instance, usually those would most likely need to be inpatient, sometimes outpatient, but it might be inpatient. If it's inpatient, you're looking at $250 per admission. Okay, so it doesn't matter if you're there for 3 days, doesn't matter if you're there for 3 weeks, it's still $250. Okay, the $2,000 is really saying out of all your services you're gonna get over the course of the year, you're never gonna go above $2,000 in your expense. But if you're looking at a complicated surgery, this is where you'd be if it's inpatient, $250, period. Okay, now of course that's each admission. So if you go into the hospital, then you're released, then you go back in again, that's another $250. But that all applies towards the $2,000. So let's say 4 times you get, well, hopefully you're not getting admitted to the hospital 8 times in 1 year, but that would meet your $2,000. So, but hopefully that's not the case. But again, as I mentioned earlier, you'll notice your in and out of network is the same. So it doesn't matter if your doctor has a contract with United or not, your copay remains the same. I'll contrast that with what you're probably seeing on TV this time of year. I know when I was flying up here yesterday, I saw even on the planes commercials, United Healthcare Medicare Advantage plans, and I was like, oh, here we go, it has started, okay. So for instance, on an individual plan, right? So some individual plans, and when we say individual plans, we mean those programs that you're seeing on TV, the commercials, the mail you'll get in the mailbox from different companies. Those are Medicare plans anyone that's on Medicare can enroll into, okay? This plan is specific to IAS. You won't see it online, you won't see it advertised because it is a custom plan for IAS specifically, all right? If you were to do a little bit of a comparison between the individual plans versus these, there are some individual plans out there that are $0 premiums, right? So you don't have to pay anything for the plan. Many times they are geographically restricted, so you have to live in New Jersey or in certain counties within certain states. If you leave those counties, your plan doesn't work, or if you move, you have to change plans altogether. Additionally, what we typically see is on the out-of-pocket, your in-network might be, let's just say, for example, $6,500 for your out-of-pocket max, but your out-of-network is $10,000, right? So again, you have differentials there on the out-of-pockets. Additionally, on your benefits themselves, you might have a $15 copay to go see your primary care physician in network, but out of network, it's like 40% because you get into that traditional PPO setup. So your individual plans, although the premium is significantly less, there are give and takes that you get throughout the whole thing. So your out-of-pockets are higher, your out-of-network is not the same as your in-network, it's significantly higher as well. So there's some things to take into account. All right, additionally specifically on your inpatient hospitalization, most of the time on those, it's anywhere between $175 and $275 that I've seen per day for days like 1 through 7, right? And then after day 7, it's $0 for however long you're in there after that. But in contrast to $250 period, no matter how long you're there, that by itself is a significant out-of-pocket saving. So just keep in mind those things when you're debating, do you want to go with an IAS plan versus an individual plan that anyone can enroll in? There are significant differences there. One question we often get when you get into, for instance, outpatient surgery, this says 20%, and people say, wait, so if an MRI is $8,000, I have to pay 20% of that MRI? Right, it should never be $8,000, but just as an example. So if you're doing 20% of that, you're thinking, oh my gosh, that's what, $1,600 I'm gonna have to pay for whatever this service is. The 20% is based off of the Medicare amount. So you're not actually being 20% of the $8,000. That $8,000 service, Medicare probably has a $2,000 cap on what the doctor can charge. So it would be 20% of that amount, the Medicare cap. It's kind of hard to find out from the provider what's the Medicare cap because it all depends on where you live and the coding, et cetera. But I just wanted to throw that out there. It's not 20% of the retail price. It's 20% of the Medicare allowed amount. And again, that would go towards your out-of-pocket as well. So that $2,000 cap, all of these services go towards that. Yes?
Is urgent care, is that a generic name or does a place have to be specified somehow?
Well, so it's any urgent care center. So if you go, whether it's like a standalone urgent care center or one that's in like a MediClinic, you know, like they have in Walgreens, they have those minute clinics now, that would be part of that as well. So yes, so if you go to the emergency room, 65, in or out of network, urgent care, 30, in or out of network. The emergency room copay, just as an FYI, if you get admitted via the emergency room, they waive that copay, so you're still looking at just the $250. So just an FYI on that. And again, your emergency and urgent care is worldwide. So if you're in Mexico or Spain or wherever it is you may be, the way that would work is you would pay the provider wherever you are, and then when you get back, we would reimburse you minus whatever the copay is. Other questions? No. All right. Some of the preventive services that are included within this are an annual physical, wellness visit. Oftentimes we get questions, what's the difference between the wellness visit and a physical? A wellness visit is really more of a consultation with your provider. You sit down, how are things? Do you have anything new going on? Any prescription questions? Whereas your physical is where they actually take your pulse, listen to your lungs, do your reflexes. It's the hands-on part of the examination. We do note the physical because today under original Medicare and the supplement plans, physicals are not covered. The wellness visits are, but annual physicals are not. So that's an additional benefit that you have in the plan as well. Oftentimes you can do these together, just schedule them at the same time. Normally when you're going to your physical, you're not just standing there, right? You're having that conversation with your doctor about how are things going. So these can be done simultaneously. Immunizations, so there's a whole host of immunizations that are covered. Your flu shots, Hep C, or not Hep C, Hep A and Hep B. Is that? Yes. Immunizations, and then you have your shingles vaccine often comes up as a question. Shingles vaccines are covered, but they're not covered under immunizations. They're actually part of the drug benefit. So they're covered under the tier 2 benefit of your drug, and you'll see what that means later on. But just as a FYI there, we always get that. Are shingles covered? Yes, but it's not the $0 copay. It is the drug benefit. The secondary question we get is, okay, well, the new vaccines, you have to get 2 of them. Do I have to pay twice? Yes, you do. Breast cancer screenings, of course, are included. Colon cancer screenings. There's a whole host of additional screenings that are covered. This is just kind of the more common questions that we receive. We do also have a incentive program for getting your preventive screenings done. So every time you get, whether it's your physical, your wellness visit, breast cancer screening, colon cancer, prostate exam, any of those, you do have the option to call customer service, and there's a gift card incentive where there's a bunch of different vendors you can choose from. They range anywhere from $15 to, I think, $50, depending on the service that you've gotten. And again, that's just an incentive to get people to go get their preventive services done. The preventive services not only are good for the obvious reasons of catching anything early. Additionally, has anyone heard of STARS ratings before in regards to Medicare plans? No? So I think it was part of the Affordable Care Act where they instituted STARS ratings. And basically they're kind of like you go on Amazon, you want to buy a product, you look at the STARS ratings, you want to pick the higher one, right? It works just like that. If you go to Medicare.gov and you put in your zip code, it'll show you a whole series of plans that are available in your direct area, whether they're Part D plans, Medicare Advantage plans, and they have STARS ratings. So those ratings are assigned by not only complaints that Medicare may receive from individuals on the plans, but also how well the plans are managing the care of their individuals. So are your members receiving their physicals? Are they getting their breast exams? Are they getting their colonoscopies, et cetera? It helps not only to catch things, but it also increases the STARS rating. So if you are four stars or higher, the plan actually gets bonus funding from Medicare as kind of a good job, keep it going, keep the members healthy, which then of course can help keep premiums lower. So there's a whole host of different things that go on behind these. This plan right now is a 4-star plan, so we do get additional funding as it is, but a lot of that has to do with this. So there's multiple reasons why we push the preventive services. One is obviously for your health, 2 is for the plan performance. So there's several reasons there. 5. You can get 5. Yep. Just like on Amazon, you can get 5 stars. I will say, just as a kind of an FYI, if you go to the Medicare.gov site, you're not going to see the IAS plan listed, only because it's not a public plan, it's specific to IAS, but you will see, other United Healthcare plans, Aetna plans, Cigna plans, et cetera. So if you go there and you don't see this, don't get worried. It's just because it's a custom plan through IAS. Other questions on that? No?
Maybe not a fair question, but how is it customized?
It's customized because...
I don't understand why it's...
Mhm.
Is there
In what way?
specific,
Yeah. So there's a whole host of different things. So one is it's customized because it's only offered to IAS retirees, right? So there's that. But again, if you look at what we were saying earlier in regards to the individual plans, they may be $0 premiums, but your out-of-network benefits are going to be, $6,500 for in-network, $10,000 for out-of-network. Your copays for a PPO are going to be in-network, flat dollar copays versus percentages.
specifically where this plan diverges so much from other plans?
On all of those levels. So on the fact that it's only for IAS, on the individual plans, it's any Medicare retiree, as long as you live in its service area, right? There is no national individual plan. They are all geographically restricted based upon which one you're looking at. Again, the copay structure is not something you will see on the individual market. It doesn't exist. And then the drug offering as well is totally different based on the copays and the coverage that you get through the coverage gap, et cetera. And we'll talk about what that means as we go through. So pretty much everything about this plan makes it custom in that it is not available in its form on the individual markets. It is only IAS. Also, you may look at this plan and say, okay, it's a national PPO. We have other clients in New Jersey who are on this same type of plan, but even their benefits are different than these benefits. You can, IAS could say, next year we're going to make the specialist office visit $35, and IAS really owns the benefits. So it's not something that you'll find anywhere else. So the whole thing is really custom. Yep. Does that answer your question? Kinda? All right. Enough for now. All right. Any other questions on that? Good question, though. Nope. All right. So we talked about the preventive services. So then just some additional services that are included within the plan. Podiatry, of course, Medicare-covered chiropractic care. We get that question often, well, what does that mean? That is really Medicare only covers manual, what do they call it? Manual subluxation of the spine, which is hands-on only. If they start putting you on machines and all of that, Medicare doesn't cover that. So this is really just manual adjustments. Medicare covered vision services and Medicare covered hearing services. What does that mean? Oftentimes people say, well, does that mean that if I have glaucoma, does that fall into the Medicare cover? Yes. Any medical condition of the eye, any medical condition of the ear falls into these Medicare covered vision and hearing services. Right, so to go from there, we'll talk about the drugs a little bit. Again, if you want to call customer service and ask them any questions on your drugs, you can call this number here, which is the same number in your booklet, and they'll go ahead and be able to look up all your drugs, compare them. They can even compare them to the existing Part D plan, just to show you that there's parity between the two. They can even do comparisons to our individual plans. So if you're saying, well, there's a $0 plan out here, maybe I want that, they can do a comparison of this versus that, tell you what the differences in the out-of-pocket will be, the differences in premium, et cetera, understanding, of course, that IAS does cover a portion of the premium, so there's that difference to take into account. All right, so as we go through the drug plan, again, this mirrors the drug benefit that is in existence today for the Medicare supplement and the Part D. So your tier 1 is most generic drugs. If you go to your local pharmacy, it is $10 for a 30-day supply. We do have a mail order company called OptumRx, which is United owned. You can get 3 months for the price of 2 if you do mail order. It's up to you, it's not required. Can you get a 90-day supply at your local pharmacy? Yes, but you don't get the discount. That's the only difference there. Maybe you look at the generic and you're like, well, it's not that big of a deal, but as you look down, it gets a little higher and the cost saving is more substantial. So tier 2 is your preferred brand drugs for your 30-day supply at your local pharmacy is $20, and then $40 for the 90-day supply through mail order. Non-preferred is $35, and then $70 for the mail order. And then your specialty is $35 versus $70. This is, so to go back to your earlier question, what makes this different than, what makes it custom? If you look at individual plans, they have 5 tiers, some even have 6. When you get into the tier 4, tier 5, tier 6 coverage, you go from these flat dollar amounts into percentages, 25%, 33%. You get into these specialty tier drugs, these medications are oftentimes thousands of dollars per dose. If you're paying 33% of a $1,000 drug, that's a lot of money versus the $35 copay you would have on the IAS plan. So again, there are significant differences just in the copays themselves between the different plans. So just keep that in mind, again, as you kind of research and do your looking there. In the back of your book, there should be a small kind of abridged formulary of our more common questions or commonly asked medications. So you can kind of peruse through there. You'll see it'll say T1, T2, T3, T4 next to the medications. If you don't see your medication in there, again, these are the more common medications. You can always call, ask customer service what the tier is, and they'll be able to let you know. You can then relate that tier to the copays that are in the book as well. I see people flipping. Is it not in there? Did you see it?
I'm not sure what I'm looking for.
Oh, okay. Let me just take again. Oh, there you go. Yeah, so it's in there. What page is that? Just to give an example. 40. Is that 40? Yeah, so if you go to page 40, you'll just kind of see the listing of the different drugs. That's just the page that we reference. So there's additional pages in there as well. But you'll see the T1, T2, that's tier 1, tier 2, tier 3, tier 4 that you see there. Did you find it all right? Just to make sure we can all see it. It helps to absorb it a little better. Yeah, so you'll see the T2, the T1 at the end of the medications, and that links to tier 1, tier 2, tier 3, tier 4.
I see. So for each and every drug, you will decide which tier it falls into?
Well, right, yeah. So each different medication will have a different tier. And there's a few things that go into that. There's pricing is one of the factors. An additional factor is how well tested it is. Is it a newer drug where we're not really sure if there are long-term effects? We might put it in non-preferred. In that case, they're also typically more expensive. Is it like Lisinopril, which has been around forever and we know it works and it does its job? Okay, it's a tier 1. It's a more preferred generic in that case. So there's a whole host of different reasons in there. You may see some additional letters next to the medications, PA, ST, QL. PA means it requires a prior authorization, which really just means your doctor has to call in and say, this is why we're taking it. Oftentimes, those are because they can be dual use. So for instance, with chemotherapy, that can be, depending on where you're receiving it and how you're receiving it, that could actually be through your medical benefit versus your drug benefit. So it requires a prior auth, so we know how to process it. Is it medical? Is it being an infusion in an outpatient facility? Is it not? That depends on how it gets billed. Additionally, there are certain nausea medications out there that if you're taking chemotherapy, it would process under the Part D versus if you're not on chemo, it would process under the medical benefit. So there's a whole host of reasons why we may need to talk to your doctor to figure out what are you doing with this drug. But again, if you see that in there on the back of your ID card, if you were to go on this plan, there's a number for your doctor to call. It's a 2-minute process, and we get the information we need. Yes?
It's been my experience that sometimes on a generic drug, the copay is more than the cost of the
Right, so there have been instances, and we see this more as like for instance, the lisinopril, right? You can go get a 30-day supply of that from your local pharmacy for probably under $5, right? Whereas your copay for tier 1 may be $10. You should not be charged $10 if the drug is less than that. No, you should be charged your normal, well, really the full cost of the drug at that point. So if you go to pick up lisinopril and it's $6 and your copay is $10, you should only pay the $6.
chances are the doctor has put it through electronically, so it's
Right.
already ready with
Exactly.
with
Yep.
the $10 copay.
Right, but you shouldn't, have you in the past had to pay the copay even though the drug is less?
Yes.
Okay, well get with me after and we'll look at that because that shouldn't be the way that it is. Yeah, you should, if the cost of the medication is lower than the copay, you should just pay the cost of the medication. So we can take a look at that. Yeah, absolutely. So good question. So any questions on this, just in general? Nope. Okay. Are you clear as mud right now? Because I'm about to maybe confuse you beyond recovery. All right. So who's heard of the donut hole? I know you probably have. The donut hole or the coverage gap. Has anyone heard of that in relation to drugs? No? Okay. I'll try to do this as high level without getting into the weeds just so I don't confuse everyone. But basically the way that Part D plans are built is your standard Medicare, the standard Medicare build for this is you have a deductible that you have to pay for your drugs, then you have your initial coverage, the coverage gap, and then catastrophic. So on this plan, again, what makes it custom, there's no deductible for the drugs, okay, just like there isn't a deductible for the medical services. So that right there, $435 is the 2020 Part D deductible. You don't have to pay that on this, so you'll start out from January 1st if you're on this plan come January with your normal copays, which are these 10, 20, 35, and 35. So starting January 1st, you begin in what they call the initial coverage level, right? So you can look at it as an allowance. You have $4,020 to use towards the cost of your medications, all right? So in January, let's say you go and you pick up that lisinopril and you pay a $10 copay and the medication is $20 in total. The whole $20 is deducted from the $4,020. So it's the whole cost of the drug comes out of this bucket, okay? So as you progress through the year, this presumably, diminishes. Once you have used all of this, you would then move into the coverage gap. Now, on individual plans, again, what makes this custom, you would then have to pay 25% of the cost of your medication, okay, on an individual plan. On this plan, you continue to pay your normal copays. So if someone asks you, does the IAS Part D plan have a donut hole? The answer is no. Does it have a coverage gap? The answer is no. You continue to pay your normal 10, 20, 35 until your out-of-pocket cost has reached the $6,350. So look at these amounts. It's kind of hard to hit that amount with these copays, right? Is it possible? I'm not going to say it's impossible, but 95% of individuals don't make it through the coverage gap just because of that amount at the bottom there. Right, so you will continue to pay your normal copays until your out-of-pocket has reached that $6,350. Right, if you come onto this plan, you can go to uhcretiree.com. You can register with your ID number when you get it, and it will show you where you stand in relation to these different stages. Right, so let's say that you do, in fact, reach your out-of-pocket cost of $6,350. You then move into what is referred to as the catastrophic level, and you stay there for the remainder of that calendar year. So everything resets in January. Okay, so if you've moved into the catastrophic coverage, your co-pays then are $360 for generics, $895 for brands, or 5%, whichever one of those amounts is higher. Who's super confused now? No? Really? You good?
I mean, it seems very generous.
All right, cool.
Now that you already.
Well,
I mean,
and again, considering that this is, an IAS plan, it's custom.
Yeah.
So, you'd look at 25% for 2020 benefits on the individual plans. There's a significant difference there in the cost. Yep. All right, good. All right, so to go from there, so these are some of those extra benefits that we asked. What are the extra benefits? So one is if you test for diabetes, whether you do it daily or weekly or however you may do it, we do have a diabetes testing and monitoring supply benefit where it is a $0 copay for a new meter for either OneTouch and AccuCheck brands. Additionally, it covers for $0 your lancets, syringes, the solution, the batteries, etc. So that is definitely a positive benefit. If you've looked at, I don't know if you've looked at the pharmacies, some of these meters can be several $100s depending on which model you're looking at. So this is definitely a positive benefit if you're looking at having to do this on a regular basis. You have a question?
Is this about the diabetes in here?
I don't know if it's in there specifically. Let me grab a book and take a glance. If it's not in this one, it is, if you were to enroll, you would have information in it in your welcome guide, or you could call customer service and they can talk to you about it, but I'm not sure if it's directly, it is, perfect. So if you're looking for that in the book, page 26, yep, the second row. So thank you. All right, so from there then, so different ways you can save. This is more for your medications. Of course, always talk with your doctor about your medications. Always make sure you're showing your ID card. It's really hard to find a pharmacy that's not in the network. I was in southern Louisiana a few weeks ago, and even some of their smaller mom and pop pharmacies take the larger carriers, United, Cigna, Aetna, et cetera. If you have questions as to whether or not your pharmacy does take it, you can go onto the website as well and just do a pharmacy search. But all the big guys take it, CVS, Target, Costco, Walmart, et cetera.
What is actually the pharmacist's like benefit? What is of benefit? How much do they actually? I mean, they have to operate.
Right.
So,
Their profit margin.
yeah, their profit.
Well, it depends on the pharmacy. I mean, to be honest, like if you go to Costco, lisinopril might be $4. If you go to Walgreens, it might be $6. If you go to CVS, it might be $5.50. It just depends on the pharmacies and what they charge for the medications. Right, so for the prescriptions. So there are certain amounts we call reasonable amounts that they can't charge above, but really it's a traffic thing, right? It's volume, just like everything else. You get more people on the plan. CVS and Walgreens and those take United Healthcare. We have millions of people on these plans. They are now going to CVS and Walmart and Target and those places. I don't know exactly what their profit margin is. I'm sure it depends on the pharmacy, but it has to be in their benefit. Otherwise, they wouldn't want to do it. So, but I don't have a specific answer for you as to what the profit margins are there. And then, of course, the home delivery program that we mentioned earlier. One of the things about this, to speak to your question, is since this is a United Healthcare company, we're able to control the cost significantly more than if you were to use a third-party mail order, like Walgreens has a mail order, et cetera. So you get the discount through OptumRx, again, because we're able to control the cost of the medications because it is a United Healthcare company.
It
Yes.
just adds more plastic to the world because they come in these great big.
They do. They come in
containers
containers,
that I
yep.
absolutely hate.
They do. Well, you don't have to, but yes. But I'll pass that along to our social responsibility team to see what they can do. All right, so from there, so to get into some of the additional benefits that are offered on the Medicare Advantage plans, again, keep in mind, these are not part of the Medicare supplement plan in and of itself. So the HouseCalls visit, is one where, again, we have the nurse practitioner come out to your home. They give you a call, they schedule it, they let you know, I'm going to be driving, a blue Chevy Cruze, and I'm going to be there at 9:30, and here's a picture so you know who's coming, so you don't have to worry about who's showing up at your house. One of the reasons for this, again, isn't to replace or supplement or isn't to replace primary care. This is just in addition to. So for instance, we had a couple years ago an individual in Louisiana that made a HouseCalls appointment. The registered nurse showed up, noticed that the individual was in a walker. It's no big deal that you're in a walker. But when she went inside with the retiree, noticed your house is full of stairs. So this is a problem, right? You think walker, stairs. If you're a nurse, what's the first thing you think of? Someone's going to fall, right? So what we were able to do is work with some community resources as well as some United Healthcare resources and have someone come in and put ramps throughout the home. That was no cost for her, but those are the types of services that can come out of really having someone come in and sit down. Now, does that mean that they're rummaging through your house? No, they're not going to be rummaging through to see what you've got going on. But it does give them a chance to view kind of your living space and see if there's anything that can be done based upon that just from a glance. Questions on that? They're not mandatory. If you do enroll in the plan, you'll get a call from us to schedule it. I think we call 3 times. If you don't want one, it's not required. We certainly encourage them, but they're not required. If you decide later on that you do want one, you can just call customer service and say, hey, how can I schedule that house call? And they'll go ahead and work with you on that. So again, either way, when the nurse is done with this visit, they will actually send a report to your primary care provider letting them know, hey, we met with whoever, here's what we talked about, here's what we found, let us know if there's any way that we can coordinate on any needs you may have. So it really is shared globally with the providers. So just one of those benefits. Additionally, I mentioned earlier, Renew is a program that really is more, it's informational, it's paired with the rewards program. Remember I mentioned if you get preventative services, you're eligible for the gift cards incentives. So that's part of our Renew program. It's also an electronic magazine that you can access on the website once you have your ID card. It has all kinds of different information, whether it's recipes, health topics, games, music, etc. So that's included in the program also. From there, annual wellness visit, we mentioned earlier, that is included in the benefits, but that's a Medicare covered benefit, so it has to be. And then your physical is included as well. So your annual physical as well as your wellness visit, they can be done together. Both are $0 copays. And this is really that consultation with your provider versus the actual physical. Gym membership, we mentioned, Silver Sneakers. So Silver Sneakers, if you want to check to see if your local gym or your current gym is part of the network, it is silversneakers.com, and you can put in your zip code. It'll show you within whatever radius you have specified the gyms that are taking part with this program. So if you're currently paying a monthly premium for your gym membership and they participate in this program, then you would no longer have to pay that once you're on this plan. So that's, you like that, didn't you? Yeah, you're like, oh, yes.
I'm just trying to encourage you.
There you go.
Never go to a gym.
Oh man. Also, if you're unable to get out and about, let's say you live in a rural area or you just have trouble getting out, they are able to send workout kits to your home if that interests you. They can be like the tension bands with the video, yoga mats, etc. So there's a whole bunch of different things you can do there. This is included in some of the Medicare supplement plans, not nationally, but it is included in some of them. So depending on where you live and which plan you pick, it may or may not be part of that. On the individual plans, we've heard some moaning about, wait, they're taking away Silver Sneakers from the individual plans, they're replacing it with Optum Fitness, which is an internal program that United is slowly building. For the group plans, so the plans through IAS as well as other employers, it is Silver Sneakers, and will remain that over the course of the next couple years. So just in case you hear that. Questions on that one at all? Nope. All right, perfect. Virtual visits, so this is a benefit I like. Some people don't like it. I like it. Has anyone done a virtual visit before? Just on your phone, you like talk to a doctor? No? Okay. So there's 2 different types that we have. We have just if you're, a medical visit. So if you're not feeling well, I've used it before when my doctor said we can see you in 3 days, but I feel like I'm dying today and I don't want to wait 3 days, or go to urgent care where you, our 2 main providers are Amwell, that's AM WELL, or Doctors on Demand. You can download them onto either your tablet or your phone. You put in your ID number, it'll tell you what the copay is, and then it'll connect you with a doctor on a video link. And so you can tell them what's going on. In my case, they were able to send a prescription to my local pharmacy. I didn't have to go anywhere except to go pick up the prescription. Worked out very well for me. I like it, but it's up to you, but it is an included benefit. Additionally, they do have behavioral health visits. If you find yourself needing to talk to someone about anything, that is included as well. That's a newer addition, but it is included also.
So it isn't your usual doctor, it's
Right, it's whichever, yeah, so it's basically, so they're the two companies, they contract with different providers nationally, and whichever doctor is available at that time. Now, once you've used it, if you, let's say you use Dr. Walker and you like Dr. Walker when you did it, you can make that a favorite. So next time you use it, you can see, is Dr. Walker on? And if she is, you can schedule with them specifically. So there's a couple different ways, but I usually take whoever's there first. Just, I don't care who it is, so just give me whoever. But there are ways to choose. Yep. Questions on that at all? Nope. All right, good. All right, so NurseLine, and this is just a benefit that allows you access to nurses 24/7. A lot of active plans have something like this included as well. If you have questions on an upcoming procedure or a drug interaction, or, you know, hey, I have this going on, what kind of a doctor should I go see? The NurseLine can answer any of those questions. They can help you find doctors, schedule a appointment with them, so on and so forth. So that's included as well. And I think the phone number will be on the information you get in the mail. Solutions for Caregivers. So this is a program that I personally just enjoy expressing interest in for everyone. So let's say that you are going to be a retiree, right? So you join the Medicare Advantage plan and you are a caregiver for any member of your family, whether it's your spouse, son, daughter, cousin, niece, whoever it is. This program provides additional support. So basically, if you were to call Solutions for Caregivers and you say, you know, I'm David and I'm currently taking care of my mother and, you know, I need some additional assistance. Is there anything available through United that can be done? They'll have someone come and do a home inspection to see, okay, what's the situation? We've had people who have been able to have you know, the handles installed in the showers through this program, or the ramps, again, have been something that have been done through this program. The good thing is it does not apply to just you as a retiree. It's really your whole family unit. So if you find yourself in a situation where maybe your son or your daughter is now providing care for you, they can use this benefit as well, even though they're not the retiree. So it's really an additional resource for the whole family. They may be able to have someone come in for 3 or 4 hours, you know, throughout the week, just to allow you as the caregiver to go do what you need to do. Maybe you have to go to the doctor, maybe you need to go grocery shopping, or whatever the case may be. So this is unfortunately not as widely used as I would like it to be, but it is an included benefit, and it's a very important benefit if you find yourself on either side of that situation. Questions on that at all? Nope. Okay. United Healthcare hearings. So if you have been on the market for a hearing aid in the past few years, you'll know that you know, hearing aids, depending on the model you're looking at, can vary anywhere upwards to $2,500 per ear. United Healthcare Hearing is a program that basically provides you with discount hearing aids. Discount is not the same as cheap, I just want to clarify. Discount hearing aids through United. This is a program or a company that we own, so again, we have that control costs on it. The hearing aids start around $699 per ear. Additionally, there is a $500 hearing aid allowance built into the Medicare Advantage plan that you can use toward the cost of the hearing aids as well. So just keep that in mind. That is included in the plan also, and it can be a significant savings if you are in need of those. Questions on that at all? Nope. All right. Good. So just to kind of round it out now, so understanding original Medicare's rules. So you have to have Medicare Part A and B enrolled in Part B, right? So that brings us back to the beginning where you're going to get that packet from Social Security just before you turn 65 that will tell you, okay, this is when your Part A starts. Do you need Part B? If you're retired and not on active insurance, then yes, you do need to get Part B. There is a premium with Part B that you do have to continue to pay as well. You can only be in one Medicare Advantage plan at a time. Enrolling in another plan will automatically disenroll you from this plan. We like to call that out because, again, this time of year, you'll notice your mailboxes, if you're Medicare eligible, will begin to fill quickly. We've had instances in the past, not really with IAS, but with other groups as well, where someone signs something and mails it back, not realizing it's an application. Next thing you know, their coverage is canceled. They don't know why. And there's a lot of footwork back and forth between Medicare and the providers and the member to try to get that back. So just be very careful what you sign if you enroll in this plan, or even a Part D plan if you do the supplement with the Part D, because if you sign something for that, it'll cancel your Part D too. So just be careful what you're filling out this time of year. In regards to people making appointments to come to your home, for this plan, you will not get a call like that. We've had that happen recently with some groups, again in Louisiana, where someone came to their home. It was an independent agent, signed them up for something different, canceled their coverage, and they want to know what happened. I will not be coming to your home to make an appointment with you, just so you know. So, yes.
So under the present system, if you have AARP and United Health for the drugs, that's automatically cancelled, or do we have to?
No, you will continue on with that into perpetuity. You don't have to do anything with that. Do you have it through IAS today? Yes? Okay, so that will continue. There is no change to that. If you wanted to move on to this, then you would enroll.
That's what I'm saying. If
Oh,
we are,
yes. Yeah, so if you want to enroll into this, then you would call and enroll over the phone. That would automatically cancel your Part D. But for your supplement, you would have to call and let them know, I want to cancel my coverage as of the end of December. And you just call the number on the back of your supplement card, and that'll get you to them. So yes, so your Part D will automatically cancel, but the supplements, since they are not federally regulated, they're more regulated by the states, they don't automatically cancel. So you'll have to call and cancel that one on your own. Let's see, you'll get an EOC from us, which is really kind of the big book with all of the contractual verbiage in there if you enroll. And Statement of Understanding is something that's in this kit as well that will just, you know what you're enrolling in if you decide to enroll in the plan, etc. So you get a whole bunch of information for us in regards to this plan should you decide to enroll into it. So to talk about the supplement, this again will give you an overview of what we have today. So some of the changes to Medicare supplement plans, if you are currently Medicare eligible. So supplement plans, again, I said they have an alphabet soup. There's really Plan A, Plan B, Plan C, Plan E, Plan F. There's all of these different plans. Plan F has historically been the richest plan. It's $0 copays, 0 deductibles, etc. As I mentioned earlier, Plan F is being replaced in 2020 by Plan G. And that is, again, congressionally mandated. The main difference is that Plan G does not cover the Part B deductible, which currently is $185. If you are eligible for Medicare prior to January 1st, you will always have the option to choose F. If you are eligible for Medicare after January 1st, then you will not have the option to ever enroll in F. That's just, again, the change in the law there. Keeping in mind, of course, that does not take into consideration some of the subsidy changes that IAS is putting in place to kind of drive enrollment into G in and of itself. So just keep that in mind. Questions? Nope. I see you processing, so.
Well, just that, so the 185 is then for people who don't have the option for F, but only
Correct.
go to G?
Correct.
Where does that 185 then?
So this $185 is your Part B deductible. So if you're on, so we're not talking about this anymore.
Okay.
We've moved on from this, and now we're talking about the supplement and the standalone Part D plan, right? So if you're on a supplement, Medicare gets billed first. They pay their portion. Medicare does have a deductible for outpatient services, which is what this Part B deductible is. So if you have a deductible and you join Plan G, you have to pay that deductible still. So if you go to your primary care physician on January 5th, they're going to say, oh, you owe $105 or whatever the deductible is for that service until you've met that 185. Because in Plan F, there is no deductible, there is no copay you have to pay. Whereas on G, that is the main difference, is you do have to pay that Part B deductible. So again, that does not exist on this Medicare Advantage plan. That is specific to the supplements. Excuse me. Your Part D plan, again, just like it is on the Medicare Advantage plan, same benefits. There is no difference. We did that on purpose to make sure that we mirrored the plan existing today. So everything there is the same as what we mentioned earlier. Same thing with the coverage gap. There is no donut hole, so all of this remains the same. All right, and then what to expect next as we kind of go through. If you join, whether it's the Medicare Advantage plan or the supplement plan, you're going to get an ID card in the mail. Please make sure you start using that come January, whether you enroll in this for then or not. You'll get a quick start guide from us that welcomes you to the plan. You have access to the website, and then we'll go ahead and give you a call with just a few health questions after your effective date to see if there's anything additional that you need from United. Right, and how to use your plan after January 1st. Like I said, just make sure you're using your new ID cards. If you're on the Medicare Advantage plan, please don't get rid of your red, white, and blue card. We had someone do that once. Keep it, but you don't have to use it. Just put it away somewhere safe. Use your United Healthcare card. Excuse me. The website, as I mentioned earlier, uhcretiree.com. If you're currently on the Part D plan, you can register for this website today. If you move on to the Medicare Advantage plan, you're able to use this as well. You can look up claim information, print a new ID card, search for drugs. It'll show you your, like I said, your whether you're in the initial coverage or the catastrophic coverage with relation to your drugs. That Renew magazine is available through the website as well. That has all the information on health articles, etc. So you'll have access to that. And then, of course, how to enroll. You can call the phone number in the back of the book or throughout the book. It's the same phone number. This will work for either the Medicare Supplement plan or the Medicare Advantage plan. This will be able to service both. So depending on which route you decide to go. And then that's it. So any additional questions that you may have on kind of any of that? No? All right, very good. Well, then I'll be in the back here for a few minutes if you guys have any questions. And I believe this will be posted somewhere if you want to review this again so you can hear it all over again if you loved it that much. So that works. Other than that, thank you very much. I appreciate your time.